Hi, I'm Allison Rutherford. I'm a first-year master's student at Tulane School of Public Health and Tropical Medicine. I'm getting my MPH in International Health and Sustainable Development.
Hello, I'm Arachu Castro, and I'm a professor in the Department of International Health and Sustainable Development at Tulane.
I just wanted to start off by asking you just some basic questions about how you found public health, what inspired you to pursue your career in public health.
I was in graduate school at the University of Barcelona in Spain, and the first day of my PhD program, my faculty advisor said, given your interests, you may want to study a master's in public health. And I was starting a PhD program. So I thought, well, this is very curious. That was in the 1980s. I wasn't sure what an MPH was at the time. And because I had studied in the US earlier in high school, I wrote to every school of public health. There were, I think, 21 schools at the time, and they all wrote me back with their programs. And I was particularly attracted by the schools that offered an international health concentration, probably because of my interest in traveling abroad and spending time in different countries. And in the meantime, I enrolled in a certificate in biostatistics. I also took several courses in epidemiology while doing my PhD. And I also was very encouraged to not just to complete my PhD, to just finish the program, but also because the program in which I was very interested in international health required to have an MD, which I don't have, or a PhD. So I did my MPH after I completed my PhD.
Okay. So to speak more about the international health aspect, what about international health really drew you in? Was that something you knew you wanted to do from a young age, or something you discovered throughout your PhD?
I became interested in international health when I started my PhD program, but during my undergraduate studies in anthropology, I became fascinated by Latin America, where I had been a couple times. And when I started my international health studies, by then I had spent already a year in Latin America, and I wanted to continue to work in Latin America because of the great social inequality in the region. And so that's where I have developed all of my research.
Nice. So is that somewhere where you still frequent, perhaps either conducting research in Latin America, taking groups of students to Latin America? Is that something you still continue to do?
Oh, definitely. I've been working in different countries in Latin America for almost 30 years.
Yeah.
And I have experience working in different countries. The two where I have spent more time are Cuba and the Dominican Republic. And those are two countries that are very interested to study because they are relatively close. They have a very different political situation, and the public health systems are very different. And I've been taking students to both of these countries, but also to other countries in the past. And I continue to go regularly. I'm actually going on Thursday. I'm going to the Dominican Republic for 6 weeks of fieldwork.
Wow. And what are you planning to do during those 6 weeks that you spend there?
Well, I'm going with one of my doctoral students. We are going to be interviewing women who have children between the ages of 2 and 5 and who live in poverty. And we are going to study some cultural factors that are characteristics of their households and how that is reflected in early childhood development.
Sounds very interesting. It's going to be a really cool experience for your student and for you as well.
When I was a graduate student, there wasn't a path for me to pursue a career in medical anthropology and less so in medical anthropology trained in public health. So I had to figure that out. When I was doing my PhD program at the University of Barcelona, I went to Berkeley to work in a study with Mexican families in the Valley. And that was with the School of Public Health at UC Berkeley. And I went there because I wanted to gain fieldwork experience. And of course, that for me was an international experience, but not from the US perspective. Yeah. But that was my first international experience. Then I returned to Barcelona, and once I completed all my credits and I had defended my prospectus, I decided to go to Paris to the École des Hautes Études en Sciences Sociales, which is the School of Advanced Studies in the Social Sciences, because I wanted to take more courses, have a different perspective. I ended up enrolling in the school and defending my PhD there in social anthropology and ethnology. I later also defended in Barcelona. But while I was in Paris working on my PhD program, for family reasons, we moved to Argentina for a year, and that while I was there, I gained also more field experience in Argentina, working with communities that lived in urban settlements. And I returned to Paris, and even more eager to continue my education in public health. So I applied to Harvard, and because it had this program in international health, in which I was very interested. And I moved to Cambridge, Massachusetts with my entire family to conduct my MPH once I had already defended my PhD. So I studied public health, but again, I was continuing to search for fieldwork experiences. As an anthropologist, I need to be in the places that I'm studying. I cannot do that at a distance. And I went to Mexico for 3 months as soon as I graduated from the MPH program, always carrying my family with me. And again, I was trying to find my path because it wasn't predetermined. And then I returned to Harvard to do a postdoc in public health. And soon later, I became a faculty member at Harvard Medical School in the Department of Social Medicine, now Global Health and Social Medicine. So for many years, I trained medical students in social medicine and in the role that social theory contributes to medical education. And I was with a team that was between Harvard Medical School and an organization called Partners in Health. And most of the work at Partners in Health, we conducted it in Haiti, in Mexico, in Peru, in Guatemala also. And I became very involved, and I also gained experience working in these countries. And again, that's what I've been encouraging students always, is to become involved in other settings and to gain exposure to how different people live and how the way you try to solve a problem, a public health program in one place has to be different to another location because of the specificity of the context. So again, I was at Harvard, traveling every month to Latin America, 1 week a month for years. And while I was doing this, working in different projects, mostly around infectious disease and mostly around HIV. While doing this work, I also became interested in working on maternal mortality because it is also, when you see the failures of HIV programs, particularly during pregnancy, that's when you understand what are the causes of maternal mortality. And while doing this work, I got a letter from Tulane inviting me to apply for a position that they had just created. They wanted a professor who works in public health in Latin America. So I came for interviews, and a few months later they offered me the job, and I've been here for 10 years already.
Wow. So you've had quite a unique experience, I would say, in terms of where you've lived, where you've studied, the mixture of the anthropology and the public health background. What would you say is a big piece of advice you'd offer someone maybe in a similar stage considering pursuing their MPH, is there anything you would offer as wisdom or advice given the experiences you've had?
Well, I've been emphasizing the importance that has been for me to gain field experience in different places. And I only mentioned Cuba and the Dominican Republic and Mexico, but I've also done field work in Nicaragua, Colombia, Peru, Haiti, and I've also worked a little bit in Bolivia. I've started to work in Costa Rica, but those are for shorter amounts of times. And again, any opportunity that students have, students who want to engage in international health, it's not easy. I mean, I don't think it would be fun if it were easy. So I would challenge students to get out and have that experience, spend time understanding how people in different societies think and work and live their lives. And that informs the way we can think about public health problems. So one is to gain that experience. The other that I highly recommend to students is to gain a lot of experience in methods. Our department offers different courses in different methodologies, and that's a great opportunity to gain skills in quantitative analysis, in qualitative analysis, and also in different subject matters: infectious disease, maternal health, complex health emergencies, and many others.
And I feel like that's one of my favorite things about our department is that people have such unique backgrounds, the professors, my peers, and so you learn so many different things through interacting with them and hearing about their field work and their experience. And I mean, I'm still in my first year, but I feel like I've grown tremendously through hearing of others' experience.
That's fantastic. One area in which I'm fascinated about is maternal mortality, because most maternal deaths are preventable, by far. And there are still lots of deaths that are happening that are happening around the world, but in some countries they happen more frequently than others. And part of it is due to the poverty or the underfunding of public health programs, the great social inequality. But one thing I have observed over the years since I started my fieldwork in Mexico was the way that women are being treated in health facilities. And there's a term for how women are not being treated well, which is obstetric violence. And I've been conducting research on obstetric violence to really from different perspectives, from the women perspective, from the health providers, and to try to really understand why it happens and how we can find solutions to eliminate it. And I've done a lot of field work with several students in the Dominican Republic, but I'm also now working with colleagues in Costa Rica. We've done a study in Costa Rica that is actually the opposite. They reversed the way they were providing the care to eliminate obstetric violence and with greater benefits for all people pregnant who are giving birth in these facilities. And now we are planning a study that it's going to take place in Costa Rica, in the Dominican Republic, and hopefully in Peru, to have a plan to render this issue, to make it more visible. Because once you identify a public health problem that doesn't have enough visibility, and you can do that through research, then it's no longer a problem that can continue to be ignored. So that's one of the roles of research, is to render visible issues that are happening and that can affect lots of people.